Okay, we are continuing on with Unit 7, Personal Care. Observations to be made while bathing. Often when you take someone for the shower, they have what's called shower sheets, and you fill those out to document any kind of thing you notice on their skin, if they have any sores, bruises, cuts, anything like that. But also you are observing for any kind of drainage, foul odors from any body area, any cyanotic skin, purple areas on the skin, or changes in the skin. When dressing a resident, always begin with the weaker side of the body. Remember the acronym POW, which is put on weak. And when undressing, begin with the stronger side of the body, which is TOS, take off strong. And you guys, most of you have already done that video. Refer to the weaker side as weaker, affected, or involved. Do not refer to it as the bad side or the bad leg or the bad arm. Warm and cold applications. Application of heat and cold have beneficial effects on injuries, infections, and fevers. You can see the cold application causes vessels to contract and get smaller, so obviously that helps with swelling, where the warm application causes them to get bigger, which promotes healing. Know these facts about warm and cold applications. Heat relieves pain and muscular tension, and it brings more oxygen and nutrients to the tissues for healing. Cold helps stop the bleed, prevents swelling, reduces pain, and brings down high temperatures. So sometimes we just use cold application for people with high temperatures. In addition to warm and cold, we have moist or dry application. Moist, it means the water comes in contact with the skin. Moisture strengthens the effect of heat or cold. And then dry means no water comes in contact with the skin. So you have to make sure if you're using dry heat that you're watching for excessive redness, pain, blisters, or numbness. If you are using any kind of warm or cold application, you're always going to check the area every 5 minutes, and you never leave it on longer than 20 minutes. This is an example of a sitz bath. Sitz bath is a warm soak of the perineal area to clean perineal wounds and reduce inflammation and pain. So this little basin can sit in either the toilet or the bedside commode. That bag is filled with water. The end of the tube has a little hole in it, so when the water runs out, it kind of squirts up and cleans the perineal area. It's almost like a little portable bidet. This would be used for somebody who has just given birth or has bad hemorrhoids or some kind of rectal surgery, just to keep the area clean. So sometimes you may be ordered as a CNA to do sitz baths, and that's what that is. Precautions with sitz bath, that anytime you're adding heat to the pelvic area, you're increasing the circulation, and sometimes that decreases blood flow, and they may feel faint, weak, or dizzy. So you have to stay with people that are getting a sitz bath or in a whirlpool. You wouldn't want to leave them in there. You've heard stories about people passing away in whirlpools, so you would never leave them when they're getting that kind of treatment. This is just a picture of a warm compress. You're going to fill the basin with warm water. Remember, always we stay less than 105 degrees. Soak the washcloth, apply it to the area quicker, cover it with a towel, and then you wrap it up and take it off in 20 minutes. Applying an ice bag, you're going to fill the bag halfway to 2/3 with crushed ice. Then you're going to seal the bag, remove excess air, cover with a towel. You would never lay the ice pack straight on the skin. Check after 5 minutes and remove after 20. Elastic wraps are used to keep a dressing in place, are used to keep splints in place. They provide support to a body part. They must be wrapped snugly for support and compression, but too tight will interfere with circulation. And they must be wrapped distal to proximal, which means far to near. So if you're wrapping an ankle, you'd start with the toes and go up. Distal to proximal. Elastic bandages. If somebody is using them, you need to report to the nurse any numbness or tingling, swelling, pain or discomfort, or skin that is cool to touch, pale, gray, cyanotic, or white skin. Procedure for application of elastic wrap, always, like I said, distal to proximal. You always want to look at the color of the skin, make sure you're checking circulation for color, sensation, cool to touch, pain, or swelling. And that's it.